morning, everyone. This is Michele Hughes at Ageless and Timeless. Today I have a very special guest. I know I say that every week that we produce, and I always have very special guests. But today my guest is Dr. Neil Paulvin. He's a functional medicine, integrative medicine. He has so many different specialties that he's going to talk to us about today. But he's located in New York, in Manhattan. Is that right, Neil? Is it downtown?
Correct. I'm based in Manhattan, yes.
Yeah, downtown. Okay, so anyone that's on the East Coast and close to New York is physically, he can see you, but he also will do telemedicine, and he's very, very active in the functional medicine world. So we're going to hear all about that. So good morning, Neil, and welcome to Ageless and Timeless.
Thanks for having me. Well, thanks for having me on. I'm looking forward to it.
The interesting thing is, when I started researching, I always research all my guests. But I look at their Google, I look at their all of their social media, and so Dr. Paulvin has his own podcast, and it's called Life Optimized. And so I just want people to know, I'm giving you a little plug, Neil, but I want people to know that because I started listening to his podcast, and I learned so much just by some of the ones he does with guests and some he does just solo, to give the listeners information that is very valuable. So anyone that wants to follow up after seeing this podcast, definitely look at Dr. Neil Paulvin and Life Optimized podcast. Okay, so we're going to jump in. Neil, Dr. Paulvin, tell us, how did you get to where you are today with all these incredible credentials that you have? Tell us where you began and how you got so passionate about being in this world of functional medicine.
Sure. Yeah. I appreciate the plug as well. So pretty much it's a lot of doctors who jump into especially like the functional integrated space, is that they either have a personal or a family story that kind of led them down the rabbit hole. And that's same with me. I was having headaches starting in med school. Nobody knew what the deal was. I tried every prescription medication, and that was horrible. That didn't work, giving me more side effects. And then I found acupuncture and manipulation and craniosacral and sauna and supplements, a couple of supplements that really helped. And I kind of at that point, I was doing a lot of family and sports medicine. I was having a lot of patients either with pain or headaches, that traditional things weren't happening or giving side effects. So I'm like, let me check out acupuncture and let me check out these different types of natural injections and functional, then became functional medicine, which begat like PRP and stem cell. And I think once you're in, and once you see how well it works, a lot of times you kind of just keep wanting to kind of keep going, learning more and more. And I always like when I hear something new, I always want to learn how to do it for myself and help my patients that way. Because I know if I'm trying to do something, I know that it's done within the whole regime. So I kind of part of it just a love for learning, but a lot of it became trying to help my patients and myself.
So when you made the transition, were there doctors that you were affiliated with that were in the allopathic world that were curious about your transition, or were they more adversarial about you leaving the traditional medical world and moving over to the more functional integrated world?
Doctors I worked with were never adversarial about it. Either they're apathetic, they just didn't, they said, they either would be like, go see Paulvin. That was a line in a couple of the offices I would work at. We know it helps people, but we don't know what it is. And I literally had patients tell me that. That's how the other docs in the referral in the group I was working with, it was a multi-specialty group, would say, just go see Paulvin. And a lot of them, they'll embrace it because, again, once they see something works and helps their patient, they're like, okay, great. It may not, again, with medicine and I guess any job, if you get from A to B, doesn't matter how you get from A to B, as long as it works and it's not going to hurt somebody. So it's more the people who, again, now you see it more with social media, people who are trying to get likes and whatever, that you see more things become more adversarial. But I think that's gotten worse now than it did even 10, 15 years ago when I started.
And so did you ever figure out what the root cause of your headaches were, and what was the cure?
The main thing is it was a combination of a little bit of, I needed some detox. and also diet changes. And then the last part was I am probably the least flexible person on the planet. And a lot of it was postural and structural. I mean, I'm literally, if I don't either do my own mobility work or I still work with a massage person and a physical therapist probably once a month to really kind of get me to help myself out with the headaches and the way I feel. So, but I'm glad to have found the main cause.
Right, right, and a lot of times it's stress too, right? Because you're going through medical school and you're practicing medicine, and you probably had years and years of cumulative stress that caught up with you, and representing the headaches were probably a combination of your microbiome, the detox that you mentioned, and your structural, your posture, and the stress.
Yes, stress plays a part. Yeah, definitely was an issue there as well.
So let's talk a little bit about how you are different than other doctors, even within the functional and integrative space. And when I asked that question, part of my reasoning is that when you look at your specialties, you have so much broader a knowledge and a practice that than even some of the best functional medicine doctors I've met over the years. So I'd be very curious to know, how did you get to be so good at so many things that you are able to treat patients? Like cranial sacral is one, that you do. So why don't you just tell us about each of your specialties and how you treat people within those particular specialties?
Sure. Yeah. I mean, I started doing, like I said, I did a lot of sports medicine and natural pain work. So I did that kind of, again, back then there really wasn't what's available now 20 years ago, dating myself a little bit here. So I did craniosacral, which, I mean, again, acupuncture, dry needling. We did trigger points, both traditional and with natural substances, from for people remember something called Shamil, to PRP, to peptides, to now stem cells, and again it goes down, it just keeps going. And again, I pain because of my headaches. Like I said, when I see patients from all over the country, now kind of all over the world, who have pain and go to 17 different, I call them like the 7-inch folder people. When we had old school medical folders, I saw so many doctors and had no answers. I feel it's my job to kind of guide them, I tell my patients I'm their tour guide to getting help, because they're just, when you get told no, or it's in your head, or you're crazy so many times, I feel motivated to help them, especially in certain issues like that. So that was all my pain training. And then a lot of the functional medicine training. Again, I got my initial functional medicine certification, and then I did a regenerative medicine certification. So, and so that's kind of, it builds up over time, because you need to learn more, and you want, again, to help patients as much as you can. And patients, even then, but even more now, they want their doctor to do almost everything in one stop. They don't want to, if they don't have to see 7 doctors, they don't want to see 7 doctors. So I try to learn as much as I can. I mean, in terms of how I can help them. And then, yeah, if I like I said, I'm a tour guide. So if they need to see somebody who does something in their disc, or is specifically a neurologist that does things I don't do, that's fine as well. I mean, but again, I think your goal is to help patients as much as you can.
And so who would you say, without naming names of the patient, but what situation would you say has presented one of your biggest challenges in terms of solving the patient's problem, and then, making sure that patient moved on to healthy living?
I mean, there's a couple. I mean, I could think, I mean, it was one older, like long time ago patient who, again, had pain, had seen for maybe double-digit years. I'd seen numerous doctors, including like the Mayo Clinic and Harvard and so on and so forth. And the way a lot of time what happened, they saw me, is I have what I call the safety deposit box method, meaning you got to turn all the keys sometimes at the same time. So it wasn't just, okay, I'm going to give you a shot of steroids or a shot of this. It was working on their posture, kind of what happened with me, working on their gut health, calming their diet down, and doing some injections, and doing some craniosacral. Doing that all together at the same time was kind of the magic key to get them back to their life. So it was that type of situation where it was just, like you said, because I have so many different tools in my toolbox, I can put all the different pieces together. I can make a much better recipe than other docs who only do one thing. I know what to do and how to put them together in the right amount and when. And then I had a couple patients recently who I mean, one especially was pretty well known. And again, it comes down to, again, it was more fatigue, brain fog situation. And those are the toughest ones because those could be 100, 200 different things. And just by, again, stepwise and combining a couple of different procedures, including some peptides, which I become much more expert with it during this time, helped them out. And again, they were unable to really work and do what they used to do on a very large basis. They were kind of working maybe 25%, and they're back at full bore. So seeing those types of situations where patients are kind of have lost their way to a certain extent, and now they're back to normal is great. So that's kind of without naming names or getting into too many specifics.
Right. Today's podcast is brought to you by Qigenics. From stem cell therapy to lifestyle coaching, Qigenics is the perfect place to go for all your health and wellness needs. This health clinic is amazing at getting you personalized medicine and wellness that is unique to you. Use the code Ageless and you'll get 20% off your first service with them. Go to www.qigenix.com to find out more information about these powerful methods. What are the conditions which create the kind of challenge that looks like it may be unsolvable, but step by step you are addressing in a multifaceted way, actually? Yeah. Because when you look at the root causes, you just mentioned, three of them: the microbiome, what was it? See, you mentioned the posture, the same things that were in your situation. It's not like this is some kind of mystery. Usually, you break it up into the pieces, right, and then you can address each one. So you keep mentioning peptides, and we've had several guests on in the past year who are using peptides. I use them myself and found them to be amazing. But tell us more about which peptides you like and what ones and what you apply them for.
Sure. There's probably three I would say are kind of really apropos here. I mean, most people know if they know anything about peptides, know BPC 157, derived from stomach acid. It's just it does a lot of things so well, injection and orally, and even we use it IV, so helpful. I love something called SS31 or MIC, which are both mitochondrial peptides that both have organ improvement, things with heart, liver, things like that, as well as anti-aging, and a lot of things are linked to mitochondrial dysfunction. And then a new one that I really love, that I kind of went in a little later than some people, is CMAX, which is a nose spray in most cases, which really helps as a nootropic, as well as helping people with anxiety and get and cognition. So I found that works really well, and it's great because it's a nose spray. So I have certain patients who don't like injections where it fit perfectly. So those are probably three that kind of are get the 5 stars. Mm-hmm. And what about the copper peptide, the CJC 1295? Do you use that? CJC 1295, I like. I use it in a lot of my patients. I find that for me personally, that it's what I explain to patients is it's not a home run for everybody. Like I have patients who do it and say, wow, I got absolutely nothing. And I have patients who say it's like the best thing since sliced bread. So I do use it. I use it in combination with some of the other ones I mentioned. But I don't use it as much as other people do. I do use it in a lot of patients though, but it's something that's usually an add-on. Because with so many things out there now, what I always want patients is, look, I want to give you something that's going to be a home run. I want something that gives you the most bang for the buck. So, but I'm always curious because everybody's biochemically different. I wonder why, if you probably asked this question, why is it that some patients get such great results and it's so efficacious, and others experience no results or minimal results? What do you think is the difference that causes that to happen? Oh, I mean, that's a whole long conversation there. I'm just trying to, I mean, there's about five main, I mean, the main, it's taking away quality of the product to begin with. It's really going to be the way, first thing is the way I say it, I have a lot of cheesy, a lot of kind of like first grade analogies. I mean, if patients are already 95% full and they're not really deficient in terms of relating things to growth hormone, they're not going to know as much as somebody who's really has barely like a quarter of a tank left. So that's one. Again,
Mm-hmm.
genetics is always going to be part of it. Um, and then also the dosing is also a lot of times I find a lot of people, the dosing is so varied, and patients either they're not taking the right dose, or a lot of patients aren't taking it at the right time. Or the thing that becomes, especially if the growth hormone peptides are like CGC and sermorelin, is that
Mm-hmm.
you get what they call tachyphylaxis, number one, meaning that your body gets used to it. So I
Mm-hmm.
patients like, come in, I've been on CGC for a year now. I'm like, yeah, it's not going to work. It just, your body builds up a tolerance to it. You need to cycle it and stop it, start and stop it. So sometimes it's just how they're using it. And
Mm-hmm.
then there's other thing again, whether medical issues they have, whether the peptides you're using with it, and so on. But those are
Mm-hmm.
the kind of big ones I could think of off the top of my head.
No, that's a very good response, and this is something that I think is repetitive in a lot of different categories. That when your body starts getting lazy, particularly with hormones, your body stops says, okay, I'm getting this, artificially or externally. Why should I keep making it? Like with your thyroid or your DHEA or any of those, the hormones. So I think it takes a doctor like you who is extremely sensitive to all of those elements of the variabilities and the individuality of the patient to be able to help them with the dosing. Like, when should you stop taking sermorelin, as an example, and let your body rest and start making its own? Is there a way for your body to make its own growth hormone, human growth hormone, if you give it that opportunity with a little stimulus from the peptide, but then rest on the peptide? Is that something that you feel comfortable with people and helping them?
Well, in terms of having them do things on their own to boost growth hormone.
So that they know that, don't rely just on the external, and because your body's going to get lazy and stop doing its job. So, how do you as a doctor with so many different patients know when to tell people to dose differently, or to dose, particularly when they say something's not working for them anymore?
Yeah, no, I mean, I do it a couple different ways. A is, I usually let patients know that ahead of time so they understand, they know what to look for. So they may tell me 2 months in, they may tell me 3 months in or 4 months in that they're, hey, I'm plateauing. That's number one. And then I said, part of my whole, when I discuss anything with patients, it still comes down to the foundation, things like exercise and sleep, which, and this is apropos, because if you're not exercising, doing lifting heavy things and getting deep sleep, you can
Mm-hmm.
take all the peptides you want or all the external growth hormone you want, your levels are still going to be low. That's when your body needs to make it. So it's kind of A, and let them understand ahead of time, and B, let them understand you can't, more is not always better. I think that's become, especially in our society now, more testosterone, more peptides, more whatever, and sometimes doing the simple things and taking a break is better than doing a lot of things.
Mm-hmm. Yeah. So, like in my case, I have been very sensitive to the awareness of that. Am I making too much? I mean, am I depending too much on the external? So I am very athletic, and I love working out, and I love the fact that I have a high testosterone count for a woman. So, and particularly a woman over 50 that wants to keep that muscle tone. So those are the kinds of patients I'm sure you see that have already done some things and still, but just want to continue on the right path and not make a mistake. So, how do you guide people like that who are not sick, but always want the highest quality of health and life that they can get? How do you guide patients like me? I'm just using me as an example, but I
Sure.
represent
I
a
mean,
whole
in
culture.
general, like I said before, I'm like, I act like a tour guide. So again, I've learned after doing this for a while, A, it's telling patients what the short and the long term plan would be, and
Yeah.
understood, so it just makes things easier for everybody if they know where we're going and what the
Yeah.
plus and the minuses are and so on. And then again, what we try to do is we look at old labs and what their traditional program is, and I say, okay, this is something where the first thing is what your goals are. If your goal, you've stated clearly what your goals are. That may not be the number one or two goals of your best friend. They may want
Yeah.
to have better sleep and energy, and it's nothing to do with in terms of muscle mass or anything else. And then you
Right.
say, okay, so these are the ways that we can do this. And you, again, because I have so many tools in my toolbox, it could be peptides, it could be hormones, it could be doing some type of biohacking technique to amp your workout up. It could be recovery. It could be all of the above. And again, I map out a short and a long-term game plan and say, okay, for the first 2 months, you're going to do this. We're going to cycle off the peptides. And then we're going to add this back in, and then we take it out. And again, it's kind of just being that type of tour guide. And like, again, the more, especially when you know a patient is knowledgeable, you use that to your advantage. It's a sense of,
Yeah.
we're going to do this and this. If patients are pretty not used to the space at all, then you
Mm-hmm.
go much slower and you kind of explain everything. Other patients who are like, look, no, I love my CJC. I want my CJC at least twice a year. You build that as
Mm-hmm.
the big two pieces of your puzzle, and then you build around it. That's what's great about what I do is that nobody's the same. And I tell it again, it's something I always say. What you do is not, like I said, it's not what your friend's going to be doing. You may get to the same place and feel the same, but it doesn't mean you may not need A or B.
Yeah.
So it's
I love.
really fun part of the job.
I know, and I love the fact that you take that individual attention, because there are so many examples in healthcare where it's kind of a one size fits all, and reach into your pocket and get a prescription pad, and it doesn't really have the individual attention and customized attention that you're providing. So I can give you a lot of kudos for taking that kind of time. When you first meet a patient, how much time do you have to spend to get to know them? I mean, just on average, what's your first appointment like?
Well, usually we do an intro call initially for a patient who wants like a comprehensive program. So that's usually 15 to 30 minutes. And then I get a whole bunch of information through my check-in document, and then it's usually an hour to hour and a half initially for most of my patients, unless we're doing procedures afterwards. And again, at that point, I already have their lab work. I usually have what they're taking or ahead of time, so I can have a game plan. Again, I can kind of tell by what they're taking where they are on the spectrum. I mean, I have patients who come in, I'm taking, again, 5 peptides and these 2 supplements I heard from Peter Attia, and then you kind of know where they are, whether they're taking like one supplement like vitamin D, and they're on the other side of the spectrum. So again, so it's about an hour and a half
Okay.
ish.
One question I forgot to ask you when we were talking about BPC 157, because yes, you're right. That is probably the most recognized of all the peptides. And however, there are 2 of them. One is the sub-Q and one is the capsule. And I think you need to tell people just what each one does, because they're different, and you don't want to be confused that you're taking a capsule that's going to help with the wound care. So could you just give us a quick explanation of the difference between the injectable and the capsule?
Yeah, now at this point with the ones that are out there now, there's not a huge disparity as much anymore. I
Oh.
mean, it really comes down to 2 things: is the strength. Yes, the injection or IV is obviously going to be stronger than the pill, and in addition, the pill is much more beholden to how good or bad your digestive system is, be it the microbiome, enzymes, movement, etc.
Mm-hmm.
But I've now had patients who do the oral for a variety of reasons, and they had a rotator cuff tear or gut issues, and they've gotten pretty good relief. It's not as 100% as the injections are.
Mm-hmm.
So like I said, it's still not a home run for some patients, but
Mm-hmm.
that's kind of the difference in terms of the strength and consistency of the medication. And there's a huge spectrum between, there's some oral pills that do absolutely nothing, and there's some oral pills which are incredible. And if you
Mm-hmm.
get a BPC injection, that's usually going to be a home run for most people.
Hmm. Okay, so because when I first started using it, they told me, okay, if you want the microbiome effect improvement, you use the capsule. If you want to inject right into the wound, like when I had a bad biking accident, broke my tibia and fibula, they said just inject right into the area of your ankle, and you'll see that it will have some effect on the healing and also on the edema that comes from having a inflammation. So that's what I was told, and that's what I thought you were going to say. But now you're
Yeah,
saying no.
the local part is definitely true. I mean, like I said, if I have somebody with a rotator cuff tear, part of the program, and if they're in the office, is going to be injecting them locally. But most,
Mm-hmm,
I don't have a lot of my patients injecting locally, to be honest.
mm-hmm,
That's it depends on the patient.
mm-hmm.
But if they do a sub Q injection in the abdomen, most of them now, I've just kind of trial and error will get very similar results. And again, I treat
Okay.
patients all over the world, so that not everybody's gonna be able to come into the Manhattan every week or every 2 weeks and get an injection in their joint, or their wound or whatever. So it's changed. It's also, I mean, BPC is probably seeing some of the more. It's gotten better and better since it came out a long time ago. So that was kind of the again, the quality is greatly improved.
Well, I am so happy we've had that conversation, Dr. Neal, because to try to do both, it is so much easier just to say, okay, I don't mind the sub Q. I'm just going to do the injectable. That's more potent, and I'll get the benefit of both the microbiome improvement and the wound healing or inflammation healing. So, everybody listening, please note this, because in other podcasts we've said, and I don't want people to feel that they've been misguided, uh, but Dr. Paulvin is updating us that there's been great improvement in that particular peptide, to the point now where if you don't mind doing injections, you're probably better off getting the sub Q. And if you really are against injecting yourself, then get the capsule. And I order mine from a company called Limitless Life. Have you
Uh-huh.
heard Limitless
I'm
Life?
very familiar with limitless life. Yes.
Yeah, and they're a research company. So
Correct.
they
Yep.
yeah. So have you used them at all, or do you
I have
like?
patients use them. I've never used them in life. No.
Okay, so is there one that you would recommend for our viewers?
Um, I mean, there's so many out there. And it also depends on what state they're in. A lot of cases, the ones I use, so a lot of companies don't work in California or even in Texas, which is a lot of my patients. So there's not. It depends on what you're looking for. It's kind of like I don't know a good analogy, but it's not one that I recommend. I choose for peptides. I get asked that all the time. There's not one. I could
There's not.
recommend. I mean, orally, I like a company called Healthgevity or Integrated Peptides for the oral peptides. But the injectables, it really I found just I've gotten down to the nuance where if I want BPC injection, I'll go to so and so. If I want
Mm-hmm.
tesamorelin, I'm going to another company. So it's not A to B there.
Right. And I also order from Phil Mickens. I don't know. Do you know Phil Mickens, IAS in England? And now they're doing a lot of the they don't they do the peptide bioregulators, which we're going to talk about just in a moment. But they are now doing them out of India, where they apparently have a very interesting um, method of optimization. So are you aware that that's happening?
I am very aware. I'm dipping my toe in with them as we speak. Yes. So
Oh,
yeah, they've gotten very popular very fast recently, especially with
yeah.
the pop for bioregulators. Yeah.
Yes. Okay. So let's talk. As long as we're on that subject, let's talk about the new kid on the block. Okay, as far as peptides go, what do you think about what Dr. Kavinson 40 years ago started doing in Russia, and has now allowed the exporting of these peptide bioregulators to other countries like the U.S. So, what do you think of them, and how do you use them?
I mean, I just applaud it. I'm amazed. Just from talking to my colleagues, kind of like it's kind of been one of those kind of under the radar things for a while now. First of all, and it's kind of gone to the fore, and it's amazing that he does do this research like 40, like I said, over 40 years ago. I mean, and built on that and showing things like improving anti-aging and improving macular degeneration and boosting the immune system. So, I mean, I think it's, I mean, just amazing what he was able to do without really, I don't, I mean, without always knowing where he was going or what he had. I mean, he was talking about telomeres, which was never even really mentioned until maybe what 5 or 10 years ago is really important in terms of health and aging. So he was definitely ahead of his time and just kind of aiming to help people. I mean, I've talked to people who've known him and kind of know where his goals were. And it wasn't like, okay, I want to build this new cool anti-aging thing. It was to help people and treat medical illnesses. And that's why part of why they're so good. And the question is, what do I think of bioregulators? Or what was the second part of the question?
Yeah, that was one question is, because they are the new kid on the block, so to speak, in the peptide category, and they are all oral. So for a lot of your patients who are, fearful of injections, self-injecting, especially, they fill a void in that respect. But I was just curious to know if you're using them religiously now in your practice and what results you've seen. So just kind of, wanting to understand the landscape of your use of peptide bioregulators.
The answer would be I love them. I've used them in a lot of different cases. It's kind of right now is kind of the beginning of where peptides were probably 7 years ago or so, five, like, and that it's people are starting to get to know them. And then they're like, "Can I just have a peptide for that?" Like this is a form of peptide. Like, well, I just want CJC. Or there's still kind of a language barrier, and people don't know exactly how good it is. Plus, it's not like you said, most of them aren't injectable, so most people think an injection is better. But I'm using them from everything as part of my anti-aging protocols with the ones that work on the thymus and the immune system, like apidolon and the thymolin and so on. The organ specific ones I'm loving more and more, and I've talked to just other people who use them incredibly. I love the fact the ones I've really kind of delved into are probably three different buckets. The eye ones, I mean, they again, just take a step back. There's depending which company, they all have different names. They're all kind of the same, similar to Cavus's peptide, but they all have different names depending on the company. If you're getting the pure ones or not. But the ones that are related to vision, or I've seen relief for patients who've never been able to really have anything else that worked for them. So I love those. The hormone ones either related to libido or the ovary or the testicle for men in terms of just health in general, like polycystic ovarian syndrome. I'm amazed. And it's great. You kind of combine them with a supplement like a inositol, or I can add a peptide. You could do red light therapy. Or you can, again, I can pull from column A and column B. And now I'm starting to, and actually trying to talk to a couple companies about, in terms of fertility, and seeing if that works. I have a couple people who've told me that they've seen improvement. Again, it's hard to figure out what it's coming from. Is it from, it's not, but I think that is really a big bucket. And the other piece now is a lot of people doing with biological age tests and epigenetics really coming to the fore too, since it does work on the gene and it may improve epigenetics. Figuring out if I take this bioregulator, does my score get better in 3 and 6 months? So we're trying to delve into that again, the combination of organ health and anti-aging. That's what makes these so exciting is everything's kind of come full circle in the sense of we now can do some organ aging if you really want to be most advanced, and we can do the liver bioregulator, we can do the stomach bioregulator. And on top of that, again, we know affecting the immune system and working on fertility and epigenetics is going to improve your biological age and hopefully your health. So everything's kind of interconnecting now, which makes it more fun. Obviously, when Jefferson was doing this over 40 years ago, that wasn't, he was just, again, trying to help people. So I think, long answer to your question, I think it's once people see the results, it's going to get really popular really quickly. It's starting to nip the bud as certain, what do I want to use? Certain anti-aging hallmarks are starting to talk about them more. I'm getting more questions. That tends to be how it works sometimes. It's a big, small community, or small, big community, however you want to look at it. So I love them.
That's a very good response because it is new. although there is a lot of scientific data that that has been done in Russia. Just it's a lot of times the United States, when something is new here, we think it's brand new, but look at acupuncture. It's been done for thousands of years, and yet in Asia, but yet in the U.S. it's still relatively a new practice, right? So people think that it is new, but it isn't really new. So Dr. Kavinson, the understanding I have was that Putin contacted him because they were having issues with their military and the Olympic athletes, and they even Chernobyl, victims. So they were trying to find something, and he charged him with the challenge to find solutions. And this is what for 40 years. And they, in the Soviet Union, in Russia, you can buy these at a regular old retail store.
Exactly.
Yeah.
There's patients who do that now in a lot of different ways. Yes.
Well, because they are supplements, they're amino acids. They're not a pharmaceutical drug. So that's important for people to know that you are taking amino acids. It's just they're much smaller aminos, and if you're taking the big amino complex or the branch chain or that, it's a whole different ballgame. But these are smaller aminos that are concentrated. And you may know this already, but I just heard from Dr. Bill Lawrence and a few other people I know in the health world that Ryan Smith at True Diagnostics, which is the company that Bill Lawrence uses along with SpectraCell for the telomere test. Those are his two baseline tests before he'll work with anyone, and all his clinical trials are with health professionals like yourself. So he's very busy, and he doesn't want to have any other but healthcare people. So anyway, the 100 people in that trial all have to take the True Diagnostic test, which tests your DNA methylation. And now what I was starting to say to you is, I don't know if you're aware of this, but sometime next year, Ryan is going to have an organ-specific result. So you will be able to tell with your patients which organs are the ones that you need to address. Then there's the bioregulators that do address individual organs. So you'll be able to be a lot more precise in your treatment, I think, as of next year.
Yeah, I'm aware. I'm so excited about.
Everybody's excited about this, and I think you and I even chatted about this when we had our talk a few weeks ago. But yeah, so this is something that I think is going to change the landscape of the bioregulators, because now instead of it'll be very customized, let's just say. So when I took the telomere test, I was so excited because Dr. Lawrence said he sent it back because he thought there was a mistake, and when it came back the second time, there was no mistake. But my results were I was from an infant to a 5-year-old telomere length. And so he said that's the best result he's ever seen. So I guess I'm working with a half of a full deck on that one, right? So
that's a good foundation to have.
I know when you have a good result like that, like there's so many different measurements that it's sometimes it can be scary. Like I took the DNA company test with Kashif Khan, that the ApoE4, the gene for Alzheimer's. It's so scary to look and see what your results are. I listened to your podcast on Alzheimer's, and I could so relate to what you were saying, that some people are just scared to know, because then what if it's a false positive, and now you have this in your, stress level goes up because now you have this other awareness. So, I mean, sometimes ignorance can be bliss. I'm not so sure it's true in medicine, though. I think it's better to know and then be able to, in advance, to be able to treat things. But anyway, I was so relieved that I had no problem with the APO4. That's the gene that's the predictor of Alzheimer's, correct?
Correct. Mhm.
Yeah.
Yeah,
So,
it's
so anyway, have you ever used that Kachi, the DNA company, the epigenetic?
I'm very familiar with it. I don't use that specific one very often. I patients will come in with those tests. I use a
Yeah.
couple other companies. There's so many great companies out there now. If I mean, I you just can't use everything.
Yeah, for sure.
Yeah, but I'm very familiar. I know doctors and patients who love his stuff.
Well, it's 164 pages. I don't mean to, use this time for plugging this one, but I was shocked when I saw how detailed. There were still things that they don't do, but it is a functional epigenetics test. So, like, I asked him about the breast cancer gene, what the broncho. Why are you not doing that? And he said, well, this is really about a functional epigenetics. So that was, a different measurement. So, but he was telling me how every day there's some new development and their test changes all the time, and there's always updates. Even with 164 pages to digest, there's, a day later, there's another development. I'm just being facetious, but,
Actually,
you
no,
know,
with this stuff, this and probably rapamycin. There may be a new study every 2 days that come out, and it's a real study. It's cool. It's good and also tough to do, but yeah, I literally every day I get some email or somebody posts something about a new study that's really cool and exciting. But just it's impossible to keep up with everything now.
you're right. And I think when I had Dr. Darshan Shah on, he runs a company called Next Health. They
Yep.
have clinics. You probably know Dr. Shah. He said, and he and I both agreed, that in the last 5 years, there's been more changes and developments, technology improvements in medicine than the last 100 years. So to keep up with it, you being a responsible provider of healthcare, that's a full-time job. So, and by the way, Ross Pelton was on my podcast last week, so we had a session on rapamycin. I'm glad you brought that up because I was going to ask you what you think of rapamycin.
I love it. I mean, I've been saying that a lot. I mean, again, that's why things are advancing so fast now. Again, it's like a lot of things we talked about. It's patients need to understand what we know and what we kind of are still postulating a little bit. And we don't
Mm-hmm.
know the exact dose of rapamycin that's great for everybody. We don't know an exact. Again, you talk to 10 docs who prescribe it. When should somebody start taking it? I had a 24-year-old ask me, should I start rapamycin? I said maybe a little bit too young to
Yeah,
do the pills form of it right now because it's probably not necessary.
yeah.
And I love the fact that, I mean, again, I'm a nerd with the studies at this point. I mean, they just started doing a study in Washington on using it for periodontal disease. They're studying it in the city here for menopause and for infertility. And these are human studies. And for people, like, human studies are the gold
Mm-hmm.
standard. Anybody wants to question something, it comes down to where are the human studies. So there's great that we're going to get
Right.
human studies, and if we see, and then also they're hopefully doing some aging studies as well soon. And I think they're going to show the positive that we see anecdotally sometimes in a lot of patients where they notice an incredible improvement from pain to immune boosting to gum to boosting bone growth. That's what we're using in periodontal disease and fertility. So I think it's great. Again, it's past the point of being niche where patients are coming and asking me for it, and I don't,
Mm-hmm.
and it's really exciting. And again, I think in 2 years from now, if we had the same conversation, it would be incredibly common for patients to be using it. I think we're
Mm-hmm.
right on the cusp of that and a lot in terms of where it's going to be really mainstream, because it
Mm-hmm.
just in terms of what it does and how broad it is, which is
You
incredible.
all the things that Ross, who wrote the book Rapamycin, he's kind of he's called the natural pharmacist, but he is a big champion of rapamycin, and he said all the same things you say. First thing I asked him, tell me about the human studies, because that's what I had read, that there's been a lot of animal studies, but not a lot of human yet. And so, like you said, that's the gold standard. So that was one question that we did address, and that is happening more and more, like you just described. So there will be in 2 years, there'll be so much more data, scientific data. But so he didn't acknowledge that, and then he also acknowledged that the dosing is still up in the air. It really is customized to the individual. And he said, in his case, he takes an injection, I think it's 5 to 6 milligrams every other week. And he does say that, this is definitely not something that you should be doing every single day for most people.
Not daily. There are people some people do it weekly, some people do it bi-weekly, some people, and it's kind of how I do it a lot of times. I have patients take a break, like every 3 to 6 months. People think you need to do it. Again, we don't, there's things that we need to still figure out. And that's probably a little further down the line. Once we know how we're going to use it for what, then we can figure out which the best way is to get in there. But it's pretty good assumption still. So we're getting closer and closer.
So when you do the periodontal, that's something that he didn't bring up at all, but that's a new area. And I think that's very exciting for most people who, there's so many people who have dental issues. So how is it used for that? What is there a prescribed dosage? Is there any anecdotal results?
There's anecdotal evidence of that it helps to build bone, especially periodontal. People use it for wound healing as well. I'm not sure how they didn't divulge how they're doing the study. I assume it's orally. People are hypostulating what would work if you get a rapamycin toothpaste. There are people who compound it into a toothpaste, but I don't know how I don't know how to test that specifically. But so it's right now it's oral. There's a lot of anecdotal things out there. And again, hopefully and I think in animals it's shown that as well a lot. In the dog studies, which for some reason have become very popular, it shows that type of background. But we'll see. Hopefully, again, like I said, in a year or two, we'll know a lot more.
Right. So then you have the terms that we discussed last week were autophagy and mTOR, that kind of like the triage of rapamycin, right? So we went through the understanding of how our diets have changed so dramatically, and the frequency of our eating is what has caused autophagy to become much more problematic. And so now if you do intermittent fasting, we talked about the 16-8, go stop eating into your dinner at about 6 or 7, don't eat again until the next day until 11. And now you've done a fast, and it doesn't even, cause any issues for you. Some people cannot fast during the day because blood sugar goes too low and they're in too much of a high stress job. So the 16-8, I don't know, do you recommend that for your patients as a way to do intermittent fasting and encourage autophagy?
Not as much as I used to. The data is still become a little more equivocal since it kind of got its vogue a couple of years ago. I like it I'll have my patients do it if it works for them for weight loss and dieting. Some people will notice when they get the ketone production and they'll notice that their cognition's better. So I use it much more now. I don't use it in in terms of just autophagy. There's things like spermidine if they're not doing rapamycin, or curcumin. A lot of other resveratrol, some of these other supplements that will induce autophagy, and I combine it with urolithin A, which helps with the mitophagy and some autophagy. So I can get other supplements to do it, and I find now that with the 16-8 or any of the fasting, it's a personal and lifestyle choice. I think there are people who thrive on it and do really well with it, and that's great. Especially now they're delving into like OMAD and time restricted eating and all the benefits for the circadian rhythm and the back to clocks again, the circadian clocks and the organ again. Everything kind of coalesces now. So I like it. I just don't do it specifically for autophagy as much anymore as I used to. And I instead of kind of be a blanket thing, and I tend to pick and choose. And the other thing is I try to target my patients away from doing it. Well, not away from doing it, but monitoring how their workouts are, especially their weight workouts. Some people I find don't put on as much muscle mass as they want when they're doing it fasted, but it's all individual. Right now we just don't know whatchamacallit. Everybody's different. It comes down to your protein intake and what your glycogen. Again, everything's so individual. Again, it goes back to if you do 16-8 and your data, if your biomarkers are great, and if you're a biological age person, your biological age numbers are great, like yours were, then keep doing it. I can't do 16-8 all the time because I might crash and I start seeing things. That's no
Hmm.
matter what I do. So I just try to fast as long as I can, and especially my non-workout days,
Yeah,
and I go from there. So it's very individual. That's my
right.
long, short question there.
Bringing up the individual, what do you think is the answer to the semaglutides, which are obviously becoming the darling of the weight loss world? Uh, do you endorse them? How do you use them? If you do, which one, Ozempic or Monjaro or Wegovy? This has become a really hot topic, and I think there's so many risks and rewards. So, what's your belief system on semaglutide?
I have a more extreme opinion than most. I love them. If used in the right patient, and going back to what I've kind of said throughout, I give my patient education before I start on them,
Mm-hmm.
of where we're going and what their goals are. I mean, if you're 100, a light female or male, and trying to get that extra 1 or 2 pounds, yeah, it's probably not in your wheelhouse automatically.
Mm-hmm.
But in terms of if you're 190 pounds and your diet is healthy and your sleep is good and you're not losing weight, they're great. And now, that's the first part, is understand in terms of weight specifically, is understanding how to use them, how to come off of them, and then how you can kind of go back and forth if you need to. And then in terms of which ones I use, I mean, in terms of specifically for weight loss, Monjaro is to me is definitely the best, which is tirzepatide.
Yes.
Less side effects, more weight loss. The new ones are coming out next year, almost be this year soon. Those even give you more weight loss, so that'll be the bigger brother, in terms of weight loss. But what we're finding now is that the benefit of that class, especially the studies that are being done with the semaglutide, which is Ozempic, in terms of the addictive behaviors, things like smoking, from smoking and drinking to even some psychiatric addictions, and that how beneficial semaglutide is. There's now Alzheimer's studies going on with semaglutide that we have shown some good benefits. Lower dosing than we use for weight loss, which is kind of the big caveat, where if you get the brand, you really can't microdose. If you get it compounded, you can. And so if you take a tenth of the normal dose, that may be your addiction dose. That may be your Alzheimer's dose. That could be your anti-aging dosing, because we know, again, it works on all these different factors. It works on the microbiome. It works on the brain. It's
Mm-hmm.
anti-inflammatory. So I love them for a lot of different things that really we're just dipping our toe in.
Mm-hmm.
Weight loss is, understanding the plus and the minuses to it. You need to get a DEXA scan. You need to work on your protein intake. I tell every patient that. If patients are losing too much muscle, I stop them immediately. It's not something that, oh my God, I need to lose that 1 pound. That's not always the best. I mean, unfortunately, people see stuff on social media.
Mm-hmm.
I don't like Wegovy. Wegovy is just as too many. It's there, but it has too many side effects for most patients. So
Mm-hmm.
unless it's an insurance issue over anything else, I don't use Wegovy as much. So
And the other thing, of course, is that of a lot of these obese people who need to use these are diabetic, type 2 diabetes. So uh, they originally, those drugs were for the blood sugar, right? For
correct.
insulin resistance. So in a way, you're getting a double whammy. You're going to help your condition, your medical condition of diabetes, and you're going to lose weight at the same time. I think the big question that you raised, the big question mark, is what happens when you want to go off of it. Now you've lost the weight that you want to lose, and now you want to keep it off. So your point of lifestyle. I always tell people, you should never diet. You should just look at your lifestyle. You had to do that with your headaches. You had to look at, what am I eating and how is that affecting me. Well, a lot of people just are so habit bound that they don't recognize that they have to change they have to get knowledgeable about what nutrients are doing what, and then become real practitioners of their own health. So yeah, well, I'm glad you given us a tutorial on that, because there's just so much confusion, and many doctors are saying, no way, unless you have diabetes, you're not gonna, if you only have to lose 5 pounds, you do it on your own. Don't depend on a drug. So there are some people that are still struggling that can't get a prescription for the semaglutide. But I think when used in the right conditions with the right doctor supervising, that you're right, that these are very, I mean, very, very safe. They can be very safe. You said next year there's going to be ones just targeted for weight loss and not diabetes. What's the name of the one that's coming out next year?
It's retatrutide. I think I'm butchering the name, but I think it's retatrutide that's coming out next year, and another one which has another long name is coming out. Those are going to be. I'm not sure what they're. I don't know if they've totally. I think one is coming out for weight loss, one may be coming out for both. Sometimes it depends on what the studies show. If their studies only show for weight loss and not for diabetes, obviously they can't go through the FDA with that. So a
Yeah,
lot of it's still to be determined depending on what their last studies show. But the initial
yeah.
studies have been really impressive.
Oh,
Um,
good,
for weight
good.
loss, I mean, specifically, and that leads to a lot of other things, like you said.
Well, good news on that one. Well, we've run out of time, Dr. Paulvin, and I've been really so impressed with all the knowledge that you have, and that you are truly redefining the term generalist in the functional integrative category. So I think that people who are listening and viewing you today will have the similar impression that I have, that you've really put your passion into your practice, and you really care about your patients, and you really want to make a difference. So I want to thank you again for joining us today, and I wish you a happy holidays. I'll probably get to meet you next week if you're going to still planning to go to Las Vegas for the A4.
It looks that way, yes. Look
Okay,
forward to
well,
meeting you there.
I'll find you. I'll text you. I'll be around for a few. I guess I'm going to be there for 4 days. So looking forward to learning a lot at that conference. And it's really the Cadillac of the industry, don't you think? The
It
A4M?
definitely is, yes. It's one of the bigger conferences out there.
Right. Okay. Well, thank you very much and have a wonderful weekend. Take care.